Who would never accept this gender diverse topic? They know these people exist.
Yeah.
But the truth is, everybody just says, shush.
The society doesn't even acknowledge that there are all kinds of people who menstruate. I think the conversation is usually centered around women only.
The truth is, these people have unique challenges. They are going through a lot. I'm looking at you like a male, and here you are telling me you're bleeding or something. The intersex body in Nigeria, intersex Nigeria had an issue, getting the name across to people. They did not allow that name. And we need to come back to the language we use. Menstruating women, that's what you typically see. Even in medical books, you see menstruating women.
Is it a myth? Is it science? Is it facts that periods sink?
It is a myth, actually. There is no scientific basis for it. First, as a doctor, you must know your limits. We do a lot of counseling, and there's a counseling tool, we call it open invite. With open invite, when I prompt you on that conversation and you're not comfortable with it, I drop it. I don't move on. And I don't step into your space. That's the only way I can say I have ethically done what I'm supposed to do. Why would I come to your consulting and you start preaching? You see me all like head to toe like this. I should come and follow you to church. What's my problem now? That kind of thing. I mean, I always say this, even to my younger colleagues, that every time I've had to interact with an MSN, first thing is that once they see me in hijab, they're already biased. But it is now my duty to tell them. In fact, when I take them to some conversation, they're like, Alaja, I say, what? I'm doing what is expected of me to do. And they just go all the way. They just keep spewing and,
Hello, and welcome back to the Talk No One Talks About, where I bring you bits and pieces of all the unpopular, uncomfortable conversations you don't get anywhere else. On this season of the podcast, we are talking menstrual health, menstrual hygiene, menstrual issues. And no, I am not doing this alone. Today we are discussing who gets left behind on the menstrual conversations. And I'll be doing this with Elena and Dr. Please tell us your name and what you do.
Hi, I'm Elena. I work as a content marketing specialist.
My name is Sekina Dwai Badmos. I'm a doctor, a consultant family physician to be specific.
Yes, very serious prof. Very serious prof. So I want to ask now, what are unique experiences, or what experiences are unique? What menstruation experiences are unique to like trans and non-binary people?
Well, do you mean in general, or you mean things that they would face specifically?
So in
Like
general, there are a
challenges.
lot of things that people who menstruate face, right? But there are also, when we are discussing now, the people who get left behind, and most of the time, those are the people who do not fit into the gender binary, or like, so that's what we are discussing now.
Okay.
What are the unique experiences that are tailored to trans people, or like non-binary, or the things that a trans person or an intersex person or a non-binary person or genderqueer person would face that are necessarily not deal with?
Yeah, so I would say, first of all, the society doesn't even acknowledge that there are all kinds of people who menstruate. I think the conversation is usually centered around women only, and this can be incredibly alienating for people who do not fit into that box. There is also the distress that can come when you are having an experience that doesn't necessarily align with how you see yourself or what you identify as. So that's also like a unique challenge as well. And then, of course, in general, they get let out of conversations such as these, and then there is little to no inclusion whatsoever. So
Yeah. Okay, Jeff.
Yeah, thank you very much. All right, so when we talk about challenges faced by non-binary persons, let me just put it that way. Sitting on the premise that, they have problems experienced by everybody. So I'm looking at it from the perspective of on top of, that kind of thing, on top of the general problem. First, I look at it from the individual perspective. So the truth is, whether we like it or not, we know that the society where we are, does not recognize these people.
The existence.
Conversations are just coming on board. And I'm happy, for a lot of organizations that are doing this. Because the truth is, these people have unique challenges. They are going through a lot. They don't even have a voice, to say the least. So first, individual perspective. So if a non-binary person is menstruating, the first thing is, for instance, a trans is seen as a male to everybody, but this person is menstruating. Where does the person start from? Is it walking to the pharmacy to get a menstrual product, or identifying with the clinician that the person has, menstrual cramps? They just look at you and they're like,
what are you talking
what exactly
about?
are you talking about? Do you understand? So individually, so people are being stigmatized. So they have this inferiority complex kind of thing. They cannot even step out to identify with the things they're experiencing. By the way, this thing is physiological. It's not their fault. Do you understand? But they cannot even, individually, yes. Then if you look at it from the sociocultural perspective as well, we talked about, the social parts where I cannot just walk. If I come today and say I'm buying it for my sister, I come tomorrow and buying it for my sister. At some point, they're like, why is it that you're the one that is always buying parts for your sister? That kind of thing.
Yeah.
So that's another challenge. They cannot even, the society does not really accept these people. And I talked about the healthcare perspective as well.
Yeah.
Where they cannot even come out to get treated for some of the menstrual challenges they're facing, i.e. menstrual cramps, i.e. menorrhagia. That means they're bleeding so much, but they cannot even come out to say. So these are unique, challenges that this group of people actually face.
Thank you very much. I also think that sometimes this exclusion can happen in seemingly progressive spaces. Like when we're having conversations and then someone says trans people see periods, and then there are people, quote unquote, are feminists, are like, oh, trans people don't see periods, let's draw the line or whatever. So I'm very glad that you brought us here. Which takes me to my next question. How does the menstrual experience affect or trigger gender dysphoria?
Well, there are like so many other experiences. As I mentioned earlier, it's something that the society would usually attribute to womanhood, and as someone who does not identify as a woman or identify with that, it's of course definitely going to trigger that experience, that feeling. Whenever you get to be on your period, or you get to experience menstruation as well. And then I think it also comes up when all these conversations are had in online or physical spaces as well. And then I think also the language too that's used in these conversations as well, because most of the time when you try to use inclusive language, it's usually not accepted generally. So I think this is also something too that can also trigger gender dysphoria.
Yeah.
Okay, Doc.
In addition, with gender dysphoria, what happens is that you are feeling completely different from the way your people are looking at you. So here is, I like using examples a lot.
Please do.
So here
Practical
is
lived experiences.
Saying that you're having menstrual cramps, and I'm looking at you like a male, and here you are telling me you're bleeding or something. The first thing is, me menstruating, at that point, the least thing on my mind is even to have that blood come out. I probably would do anything possible not to menstruate. Here I am still battling with my perception and my internal feeling. What the world perceives of me and my internal feeling. And here menstruation comes. So trust me, it's going to give me a lot of mental stress.
Yeah.
I am anxious. I am depressed. I'm having some form of post-traumatic stress disorder. When there is the trauma here is the menses.
Yes.
That's the truth.
And it's actually mentally, it's a huge mental burden for people who are even in the binary, for women, in quotes. And I can imagine. I can only imagine, because half the time I'm like, what's this? Why am I here? When did I sign up for this?
Yeah, and also, a lot of trans and non-binary people go through a lot of effort to have experiences that reaffirm their gender identity as well. So it's also a challenge when you do all this and then there's something beyond your control as well that happens that just takes you all back. and it can be very, very,
It's like a
very,
cycle all
yeah.
over again every other month. So what would you say can we do? What would we do? What do you think we can do? All of us at the forefront here having these conversations, or people who care, or people who work in these spaces. What can we do to ensure more inclusive and, would I say progressive, more inclusive period spaces?
I think like the first and the easiest point of contact would be to use inclusive language. It's basically the easiest thing that anyone can do. Recognizing that everyone has diverse experiences, and in a way, this menstruation is something that we all have in common.
Yeah.
Despite our different and vast experiences, and it really doesn't take much to actually recognize other people who are different from the binary as people who also experience this as well.
So the very first thing is what we started.
Yeah.
Let us start conversation. Years back, we cannot have this conversation, trust me. You can't even have a space to have a conversation like this. So we started right. We're starting this conversation. But my challenge is always how to get that pepper seller, bread seller on the streets of anywhere in Nigeria to view this, one, then to understand.
Yeah.
So what means is that we need to start getting into the rural community. The urban community is a wide space. Somehow, somewhere, you need to just know somebody who would know somebody who would know somebody that would link you to somebody who knows something.
Yes.
But in that space, nobody knows anything. So we need to start the conversation at this very, very distressing setting. I'll put it that way. It is actually a space where we need to bring up a conversation nobody really talks about. That's the truth.
Yeah.
Let us get into the
conversations
community.
like this.
Yeah. Let us get into the community, where we go to the level of these people. They know these people exist.
Yeah.
But the truth is, everybody just says, shush. A mother says, you cannot say you're experiencing this. It is, you don't even open your mouth. Do you understand? Because they're already seeing you as an outcast. They are ready to, bind you and cast you into the seas or whatever. So really, we started right. That is by starting this conversation. But beyond here, beyond this space, let us see how we can include them. Because if we're really talking about inclusivity, let's look at those people as well.
Yeah.
Let's include them in our conversations. Let's include them in our strategies. Let's include them let them come here and have a talk. Let them tell you the real life experience and how they are suffering and struggling. Do you understand? So really, it is for us to increase the conversation. And like she said, the language.
Yes.
We are in a space where the truth is, just like we say in medicine, the way we practice medicine 10 years ago is different from the way we practice medicine today. Yeah. Things are evolving. The world is changing. People can come out to talk about domestic violence and sexual violence. In the past, nobody could talk about it. Your mother would hide you under the bed and say, don't say this person did this to you. But now we are starting the conversation. So yes, let us now look at the language. If we all start talking about people who menstruate, just like the people who are diabetic are saying, don't call us diabetics, call us people living with diabetes. Call us people living with HIV, not HIV patients, that kind of thing. So let's say people who menstruate, persons who menstruate.
Yeah.
That way, everybody can step forward and say, okay, I can now raise my head and say one or two things.
Yeah.
Do you understand? That's another thing we can look into.
Oh, great. So, I think you said something and you reminded me of something. Like when we have conversations like this, we tend to forget that we are at different literacy levels in society. And sometimes we have all these talks and then we use all these lingua and languages. And like you said, the target should also be the people not lower, but people who do not have like the literacy level that we have or like educational advantage that we have. So think of how to break information and relay it in a way that they digest and accept it. And then you mentioned something else. You mentioned, what was it? I think you said about language and inclusion, right? Because it happens a lot. When we say people who menstruate, and women are always like, they're taking the womanhood from us. They're erasing womanhood. Like now, they can't even call us women anymore. And it's all self-centered and absorbed.
A place of ignorance, mostly.
Is it?
Yes.
Because now I hear this thing from people who are seemingly learned. People who claim to be progressive.
like no matter how enlightened or learned someone can be, when you already have like a subconscious bias, yes, there's every tendency for you to be ignorant. And most people, if we're keeping it honest, they don't really like care much about
people outside of their experiences.
Exactly. So the motivation to like learn about these things is not exactly there. So that is why it's very important to have conversations like this, like acknowledging that someone else who does not fit into your own box
has a
similar experience. It's not erase or take it away from you. It simply just like acknowledges them as well. And it's important to keep reiterating this over and over again to validate other people, as well as to put the knowledge and the information out there for people who do not know, because a lot of times this is bias, this is like public opinion, this is like a lot of misinformation as well on the internet that comes into all these conversations. And of course there's also the hate too as well. So it's also very important to have conversations like these and also express that yes, acknowledging, including, and creating spaces for other people does not take away from your experience, doesn't take away from who you are. This is just a way of making it easier for someone else who needs it just as much as you do, or even more.
Sometimes people act out of ignorance, really. When I counsel people, I say, life is not black and white. There are shades of color in between. There are shades of colors in between, but a lot of people don't realize that. When you see through other people's lenses, you know what some people are facing. For instance, an intersex person who is intersex by anatomy. This person is menstruating and this person has male hormones flooding the person's body. It is not the person's fault that the person is menstruating, but someone somewhere might not even know these people exist. I mean, in the real sense that they experience these things. So if I come to you and I bring practical examples like that, so really, this really exists. So really, some people are not aware. And some people are not open to the conversation. Because sometimes when you're open to conversation, you see through other people's lenses. And when you do that, you understand what some people go through. I'm sure if we present lived experiences, people would understand why we need to have an inclusive language, we're talking about.
So I'm so glad that you said this, Doc, as someone who has engaged these conversations a lot, and as someone who has engaged them with people who I would say were not ignorant. I like to call bias, right? And it's not that the bias, for me, because I've come to learn that some people just want to, there's a selfishness that comes with gatekeeping experiences, right? And they just refuse to validate the lived experiences of other people. It's not ignorance sometimes. And I want to know what we can do in situations where you know that this person is not ignorant. There are popular people who will not name. There are popular people who have spaces, do you understand? Who have the experiences, who have access to the information, who probably even have lived, like people with lived personal experiences who they've had contact with, but they refuse to still acknowledge the humanity or the humanity of these people enough to have like inclusive language too. So like, what happens then?
Well, I would say like there's always going to be people who want to stay stuck with where they are. And to be honest, in the grand scheme of things, they are quite irrelevant, because at the end of the day, when you keep having conversations like this, when you keep engaging the people who are actually interested in learning, actually interested in inclusivity, true inclusivity, then change is going to happen regardless, And I usually like to approach these conversations from good faith, right? But after some time, it becomes clear that someone is not really interested in what you have to say. You just leave them where they're at. But it doesn't mean because these people exist, this conversation should not be had. They're going to be had regardless of whether people are going to say something or not. And with time, it becomes more and more popular, more and more common. It's easier for people to speak up. Exactly.
Experience. Yeah. Thank you so much.
I mean, life naturally is not made to be uniform, really. It was not created to be uniform. That's why we have diverse
supposed human to have
beings.
Contrast.
Even in medicine, we say a lot of people fall within +2, -2 standard deviation. What that means is that not all the population would fall under your curve. You still have people we call outliers. However, in advocacy, you don't close the doors to advocacy, right? We keep talking to these people. We keep making them see reasons. But I know that some people will never see reasons. It doesn't stop. Remember I said majority of people are within the +2, -2. And that's it. That's actually the law of life.
So I think
Face
I have
those
to understand this
and
+2,
trust-
-2.
Don't worry,
first.
don't bother.
Because me, I've closed the doors to my activism.
I
I'm like,
get
I'm going to
that.
leave certain people where they are.
Yeah, I
and
mean,
like you said, in the grand scheme of
it's
things, they're
better.
irrelevant. You don't even
there
have
are people,
sense.
I
I'm not
think
going to
it's
bother
great
about your
for
opinion. I'm
people-
sorry.
I think it's great for people who like to have conversations with people who clearly are not interested
Yes.
in learning. But personally, like at some point, I do give up, to be honest.
I do.
You know, but I think it's still important too, because even if you don't get to change their minds specifically, there are so many other people too who listen to them, who see these conversations, who are privy to these conversations, that by virtue of you explaining to someone who is clearly obstinate, you are also explaining to somebody else.
Do you
So that's why I
understand?
think it's important.
So you might be reaching more people. I mean, you're passing through the person to reach other people. You're not just, I mean, like I said, there are outliers. There are people who would never accept this gender diverse topic.
Conversation.
They
Yeah.
would not. They would not. There is nothing you can do about it. But would you now ignore the people who are ready to have the conversation? Definitely not.
Okay. So, this next question is something that I always tell people, right? It's not just with gender. It's not just with misogyny. It's not just with advocacy. It's like, it's advocacy in itself. But I always tell people that language is a tool of oppression, right? With everything, if tribalism, culturally, language is such a powerful tool and people neglect it. People are like, even the way we react to language, the way we use language, right? Even if sometimes we claim that we are doing this in good faith and we are ignorant or whatever, and then you tell someone casually that this language, first of all, that's where you start. Like, it's not like you have to do something big at first. This language is where you start. This language, there are certain things that you say. There are certain words that you use when you're expressing certain emotions and certain thoughts that just closes the door to another person's vulnerability and safety, right? Like, language is harmful, and language goes a long way in enforcing exclusion. So now bringing the conversation of language into gender, out of the gender binary, people who are trans or intersex, non-binary, how does language enforce exclusion in these spaces, especially discussing periods?
So I think one big way language enforces exclusion is that when you look at the advertising, when you look at conversations, when you look at products that are made for people who menstruate, I think generally it's just
Women and girls.
Exactly. I mean, I don't think I've come across an ad for pads, for example, that would probably have a non-binary person
Or like
or
an
a trans
intersex
man
person.
in the video, you know. So I think like language and communication plays a big role in this exclusion, especially in this topic, because generally it's just centered around women. And then, you know, that's why it's quite important that, you know, this is part of the places we start with. If we're trying to include other people to have similar experiences as well.
Okay, talk.
You know, I mean, whilst we were having this conversation, I mean, something came to mind, and the truth is, talking about language, some people would rather prefer this conversation just stays non-binary than say intersex. That's language.
Yes.
Some people are more comfortable saying just keep it as non-binary. Just leave intersex out. But the truth is, whether we like it or not, we at some point would have to come to that reality. Intersex body in Nigeria, intersex Nigeria had an issue, you know, getting the name across to people. They did not allow that name. They had to make them, you know, do a lot of things around the name, because how does it sound? Is it sounding like LGBTQ community kind of thing? So coming down to menstruation, really, like she rightly said, I mean, a lot of ads. But come to think of it, when we see ads for men's underwears, we see females there, right? So why can't men be put on the ads for pads? I mean, I'm just thinking outside the box. If we are really sincere, but the truth is, whether we like it or not, we need to come back to the language we use. Menstruating women, that's what you typically see. Even in medical books, you see menstruating women. Even in conversations, menstruating women.
It's such it's such great injustice to like people who are biologically intersex, right? Because it's like even medically, the medical profession
Exactly.
has suppressed the identity of intersex people. And I say this because when we're younger, there would be stories of like an intersex child and how the parents are forced to like pick a gender, and then they offer gender, what's it called? They do a gender reassignment to, okay, pick a gender. If it's a boy that you people wanted, you now do a physical reassigning, and nobody's thinking about how these surgeries affect people. So that in itself, I feel like progressively affected the number of, the number of intersex people we have in our society, right? Or the number of people who probably even know, because I feel like a lot of people will grow up and do not know that they're actually intersex, and then struggle. So,
I said something that the way we practice medicine 10 years ago is different from the way we practice it now. Back
true.
then in medical school, we thought that when you have something like this, you do your karyotyping, which tells you the chromosome the person has, then you do corrective surgeries and everything. But now, I mean, in the past, some disorders were disorders, but now they are seen as norm. What I'm saying in essence is that medicine is evolving. Things are changing. The world is changing. We need to now start these conversations with the right stakeholders, i.e. the obstetrician and the gynecologist, the pediatrics, the pediatrician, the pediatric surgeons. Let's say it's what it is. I mean, let's call it what it is. For instance, we've seen cases where somebody was born with something that looks like a female external genitalia. They did a lot of things, and they groomed the person as a female. But the effect of hormone came. We saw this female who is bearded, broad-chested, no breasts, is bleeding inside something that looks like a uterus. So the truth is, beyond the anatomy, beyond the physiology, there is now the hormonal part that really tells us where exactly this person is likely to fall in. So really, the conversations are growing, and we hope that the conversation will grow further. Yeah. We need to go back into the medical curriculum. That's the truth.
Thank you so much for saying that, because I have had this conversation again with people a lot from research, right? When I said to understand gender politics and how it affected like intersex people or people with like imbalanced hormones and all of that, I started to do my research. I read a lot and I like to do that. So I tell people, because then when I was in this research, I started to remember, something happens and maybe something is repressed or whatever, but like something happens now and I remember, wait, I think I've had these conversations before when I was way younger, where they talk about the correction surgeries. And anytime I talk about it, people look at me like crazy, like they really did correct. I'm like, yes, they did correction surgeries on people. And a lot of times it was in hushed tones, like, oh, when they born the pikin, they like this, yes. So they can't pick because na boy she wants or na girl she be fine. Do you understand? So people did that. And I'm so glad that I feel so seen. I feel so validated. And I'm glad that we said it, you just said it out here. And of course, the medical profession is evolving. But like years ago, this was not this situation, and people are now living with the experiences or the repercussions or like the effects of those closed doors surgeries that were carried out years ago. So how would we say that how can menstrual justice include or cover for all the people all classes of people who see periods? Well, I think we've talked about this, but like touch base. So like just more deeply.
Yeah, inclusivity basically in language, in advertising, in the media, and more importantly, like creating the space for people to share their experiences without shutting them down. Because most of the time when you have conversations like this, to be honest, it's usually just other people speaking about their experiences. I think it's important for them also to be able to speak about what they experience, what they feel, and also make it a norm as opposed to just, the exception as well. So it's important to have these inclusive spaces, representation as well, and also have them speak about their lived experiences as well, just as you said earlier.
Okay, Doc.
Yes, so I mean, like she rightly said, we really need to look at the broader perspective. With inclusivity comes everything, the name we call them, the available materials. I said something earlier.
Yes.
I mean, some people, because of their anatomy, cannot wear pads.
Yes.
So where do you put them? We really need to open up the conversation. Let these people come to a round table. Let them tell us their experiences. Let them tell us what would work for them. They are the owners of their bodies. They are the masters of their bodies. They tell us what exactly they want to see in that space. Advertising, even, the way we build public toilets.
Yeah.
I mean, it's either you are male or female. So ask me, where do I enter? That's the truth. So if we have gender neutral, male, female, that's fair. So I can walk in, change my pads, change my tampons, change whatever it is I want in a gender neutral space without somebody looking at me and saying, what
I think
exactly?
also like having these products available in every space.
In every space.
Would also help,
yes.
So yeah, that would also be a really nice way to include people like trans men, for example. Like exactly. I think there was a time ago and like, why should there be pads in a male bathroom? It's like, because there are so many other people who have periods as well.
I think that the bias also comes from, would I say, what's it called? The attack on body autonomy. Because people were okay with gender correction surgeries when parents did it for children, right? But when people grow up, the idea that you had a gender correction surgery because you as an adult wanted to is what people are now very averse to. Because when we have these conversations and then we talk about the earlier on stages of it, everybody goes numb. They're like, now I don't have anything else to say. So you don't have a problem with gender correction, or you don't have a problem with gender affirming surgeries. You have a problem with
I don't
people
even think
wanting the
it's
decision.
a problem with gender. I think most people have problems with gender affirming surgeries. It's only a problem when the person is trying to go back to the binary. For example, like in the intersex situation, in the intersex example, they feel like the trans is trying to make their kid normal or something like that. That's when they'll feel like it's okay. But when it's something out of the binary, then it becomes like a huge problem for people. So
people would be uncomfortable with gender assignment surgeries on personal basis for a very long time. Let's face that reality. And that's because we are in a space where some things are not accepted. If a mother comes out and says, in fact, that's the reason our mothers, went for the surgeries in the first place. My child has to be a male or a female. Yeah. They didn't do it out of, harm. They wanted good for their child. They didn't know they were causing harm. I mean, they were just trying to help. That space is still a bit acceptable. But the other space, we are going to talk about that for a very long time before we get there. Because of our societal norms, our political norms. That's the truth.
And now I think that they attack even that earlier surgeries as a woke virus. I think that's what they call it online. It's like, oh, don't do gender assignments on children because they can't decide. Well, the same set of people are also attacking adults who want gender affirming. Yeah. So I like, at what point? And it's all, when we talk about gender affirming, for me, it's a spectrum. It's huge. It's also women who are doing things to make them more feminine by their books, right? It's also men who are going through not just surgery, like doing stuff or taking pills to look more masculine by their books. And I feel like if we as a society started to have these conversations, like, do you know that thing that you do, you're also in the bracket of people who are doing gender affirming, right? Then people will not feel so alienated from the conversation or like so different or so righteous. Right?
Perhaps. Because it's just quite hard for
because
people to
like
see
a lot
themselves.
of times people are doing the BBLs and the liposuctions and the mommy makeovers and all of that.
Like I said, in all sincerity, at that point, when you bring this presentation to the table, you will tease it out. They will tease it out for you and tell you this is different. There are variants. That variant you're going into, don't even enter there. This other variant's acceptable. But that's the truth. And it still takes us back to the society where we are. We are not, we didn't drop from heaven, right? Yeah. We didn't drop from heaven. We are still a part of this society. And we might come back to this conversation in 10 years and we see that everything is the way we want it. But right now, that conversation will not pull through.
Okay. So I think I'm just going to leave us with what you said, like whether the conversation is difficult or not, we're just going to keep trying to have it.
exactly.
Yes.
Right? Because some people might be blockheaded and some people might be open, but like we are just
Yeah.
going to whether
It's still
they're
important
accepting or not.
regardless.
Yeah. So let's step outside from that now. We want to talk about the myth. Is it a myth? Is it science? Is it fact that periods sink? But the general knowledge is that when women are close, when women share a bond as friends or as sisters and physically live together, even not physically, mind you, their periods, the circles might be different, but after a while it gets to synchronize. How true is this? Let me start with you, doctor.
Yeah.
Let me get a thought on this. Then I
Okay.
cannot bring.
Okay.
wow.
Let's get her
Okay.
thoughts on it.
I don't know how scientifically proven it is, but to be honest, I have actually had my period sync up
Same here.
with my partner, and it was quite weird because I think for the past 3 months, 4 months thereabouts, we see our periods around the same time, at most 2 days apart, and it was totally entirely different before. So that's my own personal experience. I think I've had my period sync up with close friends and stuff.
Yeah.
But I don't think that there's any scientific study or something that proves
Okay,
that
I think
it's
the
a thing.
doctor has a
Thank you
question.
very
Yeah.
much. So, in the medical space,
Let's doctor, tell us first. No, before you go to the medical space, I want you to tell us, has your period synced with someone?
no, not that I can
Ever?
remember. Never.
Doctor is about to debunk it for us.
Okay, so yes, in the medical space, what we practice is what we call evidence-based medicine. Evidence-based. If it is not evidence-based, it is not medicine. The truth is, no, but on a more serious note, let's talk evidence and let's talk, reality.
Let's also
Okay.
talk practicals. Those who their period have synced in the house say I. Please, the eyes, do we have it or not?
Oh my god.
Okay, let's go back to
All right, so
evidence-based
so the
medicine.
truth is, there is no scientific basis for it.
Hmm.
If we look at menstruation, there are so many factors, that make us menstruate.
Mm.
Physical factors, hormonal factors, environmental factors. We can say the sinking thing might be a bit of
hormonal.
some environment. No, it's not even hormonal because you're
Oh,
not
okay.
sharing any hormones, really.
Okay.
You know this thing they say about couples looking alike after some years,
Yeah.
right? You now look like
Is that
siblings.
environmental too?
It's not environmental. It's not scientifically proven, but it happens.
Okay.
And
so,
they see the two of you and they're like, you look like brothers and sisters. So, I mean, that one, maybe because, all the testosterone is, all the sperm cells are pouring into you. So somehow they've done some mutation, but really it's not evidence-based. So really, it is a myth. Like you rightly said, it is a myth, actually. There is no scientific basis for it. Because for you to menstruate, like I said, it is a combination of factors. Hormonal factors, physical factors, environmental factors. And our hormones don't have a semblance, really. They don't. We all produce estrogen, right? But we cannot say your estrogen looks like my estrogen. They are chemical components. However, some other things would be your own genetic makeup. You understand? Then environmental factors. So, for instance, that was why I was saying that might sit somewhere under environmental factors. For instance, when some travel. When some people travel out of their comfort zones, they don't menstruate. They don't see their periods. When some people try out new foods, they don't see their periods. But really, scientifically spoken, no evidence for menstruation sinking.
Justice for people who with their periods.
I mean, it could be like a lifestyle thing. If you spend a lot of time.
So
with
more
someone,
socially than medically.
Yeah, I think it could be if you spend a lot of time, a lot of things can change your cycle. For example, maybe stress, maybe something else that's going on. And it's possible if you're spending an extended amount of time with someone, you guys are doing the same things, you're eating the same things, everything combined could possibly affect you guys.
I love that school. I love that school of thought. I love it.
So
Yes, because it brings us now to the genetic semblance of the hormones. Or how did Doctor put it?
it could just be a coincidence.
Here's the thing,
really.
right? I'm going to say that even though I like to read and research, and I do a lot, right? And even though I like to give respect to facts and stuff, that I'm also a very practical person. I'm not going to buy the books, erase the physical or the actual practical experiences and the lived experiences. And it's something that I've experienced a couple of times and has actually had me like,
For instance, I have never experienced it. I lived with one person throughout medical school, 6 years. Our periods did not sync.
and you were best friends.
Best friends till now. Interesting, right?
Interesting.
But I gave birth to her somehow. She's a twin. I gave birth to a twin.
Okay, so you see, and you didn't have history of twin in your family. Okay, but let's just stick it with the best friend. Okay. So I like to believe that sometimes there are certain things that, like you said, let me quote Doc, like you rightly said, they are not gray. They are gray areas sometimes.
Yeah.
It's not always white and black. It's like there are gray areas. They are dark gray. They're just it's a hue of colors.
Shades, different shades.
So, brings me to my last question today. How accurately can we track periods, and what apps or how can period apps step in?
I wouldn't know much about accurately tracking period because I've dealt with PCOS for a very long time, and most period tracking apps and softwares have not been effective for tracking my period because prior to I had to see so many like doctors, specialists and stuff, and we all know like most of the healthcare professionals here in Nigeria, there's always this very weird
myopic way of
there's a lot of medical misogyny.
Yes, doctor.
Mile?
Yeah, doctor, please.
Medical misogyny and whatnot. So it wasn't really easy getting the professional help for this. So period tracking have not really been helpful. But more recently, I spoke with really a really helpful professional as well. I was on some medication that helps. I started using this app, and it's actually
Which of
not
the apps
so bad.
is it? Okay. I don't think we should do that.
Yeah, so it's not so bad. I mean, it's been accurate so far, but it hasn't been a long time, so I'll see how it goes.
Okay, so doctor allegedly the myopic
I don't know where I don't know where she's been seeing doctors or who she's been consulting.
Well, doctor, this is a common knowledge with Nigerians.
No, I don't understand I don't understand the part where she said myopic knowledge.
No, I did.
No, I didn't say that. I said there's
she did.
Yeah, I did.
No, I mean, like generally,
to be honest, most medical people, like now, doctor, you are trained like dealing with social issues.
Yes,
so you are like a more equipped medical doctor.
You are actually the exception.
Yes, and the health professionals who have like experiences working in social fields or being trained like with humanitarian organizations, right? And working with organizations like ours, right? You have more experience and more expertise dealing with people of different experiences. Most of the others don't.
Okay, so, well, I think I need to say this. First is, medicine is very wide, right? And we have different levels of professionals in medicine. A surgeon will probably not have this much conversation with you.
Okay.
Because he has his area of expertise. If you see a gynecologist on matters around PCOS, you're fine. But a lot of people cannot even tell us.
You see a closed-minded gynecologist as a non-binary person?
Some people might not even. I mean, I know that you guys are probably aware that there are different doctors, right? Some people would say they are seeing a doctor for this thing.
Yeah,
Ask them who they are seeing. They are just seeing
a general doctor.
Yeah. And the person would not tell them that. I mean, if for instance, you're seeing the person in a private space, the person wants to make money. I mean, it's wrong practice, really, because there is, they say every doctor must know their limits. There is a point you would get to where you say, see the specialist. But a lot of these people just want to keep, the patients. They want to keep the clients, as the case may be, rather than say, go and see the specialist. So they do a lot of trial and error. That being said, I am also aware that you might meet some family physicians in my same space and they don't have this much knowledge because exposure is something, curiosity is another thing, and we all have different areas of interest. What catches my fancy might be different from what catches your fancy, yet we are the same professionals. So you're correct, you're right in that regard. However, back to the main question, right?
Yes.
Which is talking about, like she said, there is no accurate
Okay, before we go to the back to the main question, I want to say that we are in a deeply religious society. And even with psychiatrists, even with so-called therapists, there are people who are medical professionals who step outside of their profession a lot and just deal with people with their personal bias.
Because I'm also actually speaking specifically about gynecologists and
Yes,
not doctors in general.
yes.
I mean, this conversation about PCOS, digress a little bit, recently came up again, and several women with PCOS came to share their experience about dealing with
medical doctors and gynecologists
and stuff. I feel the conversation was mostly centered around having to deal with male gynecologists,
yes,
because like having to find,
and there are
like
more male gynecologists
like there are so
than there are
many
female
more of them than there are like women that actually like listen. I mean, the time I even got diagnosed with PCOS was when I spoke with a female gynecologist, because initially and then there was little like attention paid to my concerns or whatever. So this having to have this in the majority would be very difficult for a lot of women dealing with this.
Yes, I agree with you. There was something you said about people stepping out of their professional space. I mean, dealing with you with their personal individual biases. I mean, the truth is a doctor, a medical professional should know where to put the boundary.
But do they?
I'm getting somewhere. Typically, when people come to my consulting room and they see me in hijab, they're biased. But when I have a conversation with them and I make them comfortable, I mean, I've had a guy tell me he was sleeping with his wife's cousin under the same roof. I've had a man tell me, I mean, there are a lot of things.
Yeah.
But first thing is that they need to get that
comfortable
trust.
And be vulnerable.
They need to get that trust before they can be vulnerable. When they come into your consulting room, you should be able, as a professional, you should be able to read their body language. I know this does not cut across. I mean, I'm being sincere now.
No,
there are some doctors I probably would not even want to consult with as a fellow doctor. That's the truth. But for every healthcare professional, we owe it to ourselves first, then our patient to be vast. However, if you have a particular space where you probably don't want to enter, let your client know so that you're not moving the person in this direction when there are myriads of options that the person has. I know that people have, I mean, this conversation is a major conversation to some people. They probably would not go there. But let me know your bias.
Yeah.
Such that I know where I'm going to end this conversation with you. And that's the ethical thing to do.
Yeah.
There is ethics.
A lot of times what I also notice is, I'm so glad that you said that people step into your consulting room and then they see you with the hijab and then they're biased. First of all, they're not biased. They imagine that you are biased. They project that the experiences that they've had with Muslims, right, is what they're about to get. So they are now sheltered, and then you now put in the work to make them comfortable, to make them feel safe, right? This is what I'm talking about, right? This is what I'm saying. Like, you have experience dealing with people of different experiences, right? And you are very open to it, right? And now, when we talk about, like, I feel like there are certain professions where it's like, you have absolutely no reason to have a bias here, because this is human life and these are humans, right? And you come in to say, oh, I don't want to deal with these kinds of people. You're there to deal with all kinds of people. But then a lot of times that's not the case. And that's where the myopic thought came from, right? Because I've had cases of people who go to therapists, where the therapist now goes to contact their family member with the information, or not give them church flyer to say, come for deliverance. Yes.
That is unprofessional.
It happens.
And it's unethical as
well.
well.
The therapist advised me to ask me if I start praying. Instead of praying, go back to God.
I'm a family physician, right? And I mean, in the white space, so a family physician is like a GP abroad, but it's different from the GP in Nigeria. A family physician is that doctor who went for postgraduate training 6 years plus X to become a consultant family physician, as opposed to the GP we have in Nigeria who who finish medical school and they start doing things. First, as a doctor, you must know your limits. We do a lot of counseling, and there's a counseling tool, we call it open invite. With open invite, when I prompt you on that conversation,
you feel safe,
and you're not comfortable with it, I drop it. I don't move on. And I don't step into your space. That's the only way I can say I have ethically done what I'm supposed to do. But I very well agree with you. I mean, I've seen a colleague.
There's also the issue of the people who create the safety and make people feel safe, then use the information that they get against them.
There's so many types of people.
I mean, and I agree with you. I mean, these things happen, and that's why we have a lot of litigation issues around Nigeria. People are now becoming aware of their rights.
Mm.
Do you understand? You can't step into my space. Why would I come to your consulting when you start preaching? It's as if I've not had
They'll give
people
you
give me
flyer, doctor.
even people give me flyer.
What?
You see me all
Yes.
like head to toe like this. I should come and follow you to church. What's my problem now? That kind of thing. But I understand, and that's why, as healthcare professionals, we should create that safe space. I told you. I mean, I always say this, even to my younger colleagues, that every time I've had to interact with an MSM, I would always get what I want, because the first thing is that I create that space for you. I've had them in my consulting room, and a lot of times when you ask a guy, there is a way you would ask a guy if he does guys that he will tell you yes or no. You must have created that safe space for the person to really open up to you. Do you understand? And that's the truth. So I know, first thing is that once they see me in hijab, they're already biased. But it is now my duty to tell them. In fact, when I take them to some conversation, they're like, Alaja, I say, what? I'm doing what is expected of me to do. And they just go all the way. They just keep spewing, and the conversation just
Thank you
goes
so
very,
much,
very
Alaja,
nice.
doctor. We are sorry that we had you defend your honor and your people and your colleagues today. And here we say queer. So the queer men, gay men, it's a very safe space and open for everyone. Thank you so much for your time. This has been absolutely amazing. We hope to have you again sometime. Till the next time. It's goodbye from the Talk No One Talks About. See you on the next episode. Bye.
Yeah.